Hello everyone, Dr. El Sayed here. Just wanted to touch base and talk a little bit about testing for COVID-19. I know there's access everyone has to the data on the latest numbers and the deaths and all of that, so I'm not going to go into that. But testing. Now, when we talk about testing for COVID-19, we need to distinguish between diagnostic testing, which is done in cases where individuals have symptoms. So these are patients who have classic symptoms. They meet certain criteria that would qualify them for getting these tests. And these are the tests that are typically done with swabs through the nose or through the mouth, typically sent out, and will take about 3 to 7 days. There are a few of these tests that are what are called point of care. So they are done in the office and take a few minutes. And so those are not the tests that I want to focus our discussion on today. What I want to focus our discussion on today are the antibody tests. So these are the tests that are looking at individuals and trying to figure out if they were previously exposed and perhaps have developed immunity to the virus. And the reason this testing is important, or why we're trying to roll them out, health experts think that these tests are important, is because if we can figure out what percentage of the population or how many people in the population are actually immune, then we can start sending these people out to go back and gradually reopen the economy and all of that. So let's try and understand how this test works. So the test typically will check for two antibodies, IgM and IgG, and I won't bore you with the immunology here, but basically IgM is the first antibody that the immune system produces, typically about a week, give or take a few days, after exposure to the virus, and typically symptoms appear, although symptoms don't necessarily have to be present. IgG is the one that takes about 2 to 3 weeks or more after exposure, and that's the one that we're all interested in, and that's the one that would tell us that we've developed immunity to the virus. Now, the interesting thing here is that a positive doesn't necessarily mean that you're positive. There's this concept of false positives, and a negative also. We can get false negatives. So let's take a look at the different scenarios. What if you get a positive antibody test? If you get a positive antibody test, well, then you have antibodies to COVID-19, but you could also be having antibodies to any of the related coronaviruses, because there is a relative, a certain percentage of cross-reactivity. Now, a lot of these tests will, the inserts will tell you about their specificity, meaning how specific they are to the virus that they are checking for. So they can have high specificity, but the more people you test, the more false positives you're going to pick up. So that's something to keep in the back of our minds. Also, as far as we know, it's unclear if a positive antibody means that you're immune. In other words, we don't know if a positive IgG is necessarily going to mean that you're good to go and you can't catch the virus and get sick from it again. And as we've seen from cases from China and other places around the world, that there have been cases of individuals who were positive, not necessarily antibody testing. These were individuals who were confirmed based on the diagnostic test to have coronavirus, and they recovered, but then they developed the infection again. So we're not 100% sure how the process works. Now, if an individual tests positive to the antibodies and they are symptomatic, then really they would benefit from a diagnostic test. That's one of the swabs through the nose or the mouth to actually confirm that they do indeed have COVID-19. And you can get a positive test even if you're completely asymptomatic. You've never had any symptoms. So you can have these antibody tests. And that's why we're talking about these asymptomatic carriers. Those individuals who walk around, have the virus, but they have absolutely no symptoms and they have no idea, which is the whole drive behind social distancing and isolation and trying to minimize exposure to other individuals. And now this whole call for everyone to wear a mask when they're out and about in case you're carrying the virus and you don't have any symptoms. Now, if your antibody test is negative, then more likely than not, you have no previous infection, especially if you didn't have any symptoms. But again, keep in mind there can be false negatives where you get a negative test, which in fact should have been positive. So the caveat here again is that 1 week window for the IgM, that initial antibody to develop. So if you just picked up the virus or you were just exposed to it 2 or 3 days prior to getting the test, then you can get a negative because your immune system hasn't had enough time to mount that immune response yet. So you could have the infection but have a negative antibody result. You may develop the illness, full-blown COVID-19 illness, and not develop antibodies. And that's one area of the immune system that's interesting. Not everyone will have the same immune response. And that could play into the fact that some individuals who recovered from COVID-19 were susceptible to a second bout of the illness. For individuals who test negative but do have symptoms, they would also need a diagnostic test to confirm if their symptoms are indeed classic for COVID-19. The limitations, as we discussed, the false positives, the false negatives, testing availability varies from area to area, as well as insurance reimbursement and coverage, which is not clear. So at this point, really, the take-home message is you got to take these antibody tests with a grain of salt. Just because you have a positive IgG, which should tell you that you're immune, should not be, a blank check for you to just go out and about and resume life, as if COVID-19 didn't happen. Forget about the mask, forget about the frequent hand washing, cleaning common surfaces, the social distancing, because we still don't fully understand how this virus operates, and we don't know the complete ramifications of what these testing results are telling us. We're trying our best here. There's still a lot of active research looking into what these data points are telling us, and we will continue to follow the data as it comes out and see how things go. But at this point, what these antibody tests really serve is to try and give us some idea to work, at least from a public health standpoint, on trying to figure out what the next best step should be in terms of being able to move forward with managing the COVID-19 crisis. So we'll do our best as things move forward to bring you any updates that are of relevance and that might be informative. Please stay tuned to our page and to our website, lsayedprimarycare.com. And thank you very much for tuning in.